Hey, trauma-informed teams! So have you ever cared for a patient who startles easily, avoids touch, or just shuts down when asked about their past? You might actually be seeing post-traumatic stress disorder, or PTSD, a psychiatric condition that's triggered by exposure to trauma that the brain just can't easily process or forget. Today we'll break down what PTSD looks like, how to treat it, and how nurses can support patients through compassion, safety, and trust. PTSD is a trauma and stressor-related disorder that develops after experiencing or witnessing a life-threatening event, such as combat, abuse, sexual assault, serious accidents, or disasters. The core symptom clusters are, intrusion like flashbacks, nightmares, distressing memories, avoidance, avoiding reminders, people, or conversations, negative mood or cognition changes, things like guilt, shame, or emotional numbness, and hyperarousal, so insomnia, irritability, or an exaggerated startle response. Symptoms last more than 1 month, and honestly they cause significant impairment. Exposure to trauma, either directly as a witness or even through repeated exposure, for example, first responders. Neurobiology plays a role too. There's amygdala overactivation, which is the brain's fear center, hippocampus shrinkage that affects memory regulation, and prefrontal cortex underactivation, which impacts impulse control. And of course, there's a dysregulated stress response and persistent high levels of cortisol and adrenaline. So, let's talk about treatment options for PTSD. When it comes to pharmacologic therapy, selective serotonin reuptake inhibitors, like sertraline and paroxetine, are considered first-line treatments. Prazosin can be helpful for nightmares and sleep disturbances. Other options include serotonin norepinephrine reuptake inhibitors, mirtazapine, and even atypical antipsychotics, which are sometimes used off-label for severe symptoms. Now, psychotherapy is also key. Trauma-focused cognitive behavioral therapy helps address thoughts, triggers, and coping strategies. Eye movement desensitization and reprocessing, or EMDR, is effective for trauma processing. Prolonged exposure therapy involves gradual re-exposure to trauma memories, helping patients process what they've experienced. It's important to remember, treatment is long-term, and recovery doesn't follow a straight path. Patience is really essential. Alright, moving on to nursing priorities. First, it's crucial to create a trauma-informed environment. Always ask permission before touching a patient, use grounding techniques if someone is experiencing flashbacks or dissociation, and maintain a calm, non-threatening presence. Next, assess for suicide risk and self-harm, since PTSD is linked to depression and substance use. Make sure to ask directly and empathetically. Supporting sleep and safety is also vital. Offer comfort measures for hypervigilance at night and do your best to reduce environmental triggers like noise or crowding. And finally, educate patients and families. Normalize the trauma response, explain treatment options and what to expect, and promote peer support, therapy, and resilience building. PTSD is often a hidden injury, but with the right care, recovery is absolutely possible. As nurses, our calm and steady presence can really help patients find safety within themselves. So, what's your best tip for supporting patients who've experienced trauma? I'd love to hear your thoughts. Drop them in the comments. If you found this helpful, go ahead and subscribe and follow for more trauma-informed care insights, because healing truly begins with how we listen. And remember, recognize, respect, rebuild safety.